First of all, welcome. At Davies, like all practices, as you know, clinicians chat about areas of interest, and we've decided to make a series of short films on different topics over the next couple of months on areas of interest, where we can have a bit of a discussion, and we thought we'd include you guys, both vets and owners and nurses, on some of those discussions, and hopefully they'll be informative. So today, myself and Julien, we've both got an interest in the microbiome and some of the newer techniques in manipulating the microbiome. Both myself and Julien are part of the medicine team at Davies. So we thought we'd just nip down the local pub, the Live and Let Live, and well, why is it unusual? Have a bit of a chat about the microbiome and some of the things we can do. So this is Julien.
Hi.
Hello. So I suppose first of all, we should just recap what the microbiome is. Yeah. So do you want to start?
Yeah, why not? Well, we all know that bugs are colonizing the gut, the small intestine in a large bowel, and it has been more and more seen that bacteria, yeast, and even viruses are creating sort of huge environment that is actually helping the health of the gut, the health of the whole body journey, and having a lot of interaction as well with the immune system and the rest of the metabolism.
Yeah.
So it is actually quite a vast and complex organism that is almost like an organ on its own.
Yeah.
So it's quite interesting, and there are a lot of studies that have been ongoing at the moment on
looking at it. I mean, yeah, for me, I always think about it like almost like a microenvironment, almost like a pond where one change in that environment will cause a reaction of different populations and things like that. And as you say, I mean, the more you learn about it, the more you just realise how complex it is and how much interaction with the immune system and even just what the bacteria metabolize and you absorb. It just shows, it's mind blowing. So I guess different ways that we can. I mean, traditionally we've always used antibiotics to manipulate the bacterial flora, but I know you've got more of an interest in probiotics. Mine's more fecal matter transplants. So I guess. So what have you found? What have you found in study-wise for indications of using probiotics? And there's a lot of studies out there, but are there any studies that have actually showed a positive outcome?
Yeah, certainly there are a few in the veterinary literature. Most of the information we have comes from the human literature.
Yeah.
We do know more than us about this.
Bigger research.
Exactly. But we do have now a few studies that have been on their way and have been published or presented in abstracts to talk about the benefits. And the things that tends to come back is generally acute cause of gastrointestinal disease or diarrhea, vomiting will tend to respond relatively well to probiotics, and occasionally to fecal matter transplants. There are far less studies on these.
There are less, admittedly. I get that, yeah.
And then we start to have a bit more of information about chronic enteropathies, but it's a much more complex topics, which unfortunately will not be very clear-cut, but it looks like some probiotics could be of use for chronic enteropathy. So it's, vast.
And are there any, because I guess one of the things I always think about is that, I mean, the microbiome's got billions of bugs and viruses and fungi, and, it's a massive population. And a lot of the probiotic preps have maybe one bacteria, and sometimes that might not even be, a canine probiotic. It might have been derived from humans. Are there any preparations that have had any studies, that are more beneficial than others?
Yeah. So the interesting thing about probiotic in the vet world is all the options that we have that are labeled for dogs or cats contain only one type of bacteria. It's Enterococcus faecium, so it's the same. It's supposed to be two different strains, but we actually feel it's the same strain, and so it's very likely that all the drugs are roughly the same. Now they do differ in some different way, because some of them add some prebiotics, some of them add some other product like cobalamin, for example, just to try and improve the efficacy of the strain of bacteria. And what changes as well is the quantity of bacteria that are present in each probiotic capsule. So it's very variable, and there are a few products that have been like study very carefully and compare with placebo,
Yeah.
and it shows some effect, especially in diarrhea in dogs in shelters,
Okay.
or in patients with some acute diarrhea due to antibiotic use, for example, because it can, as we know, affect quite a lot of microbiomes.
Yeah, I suppose looking at the fecal matter transplant, that's, I mean, I almost kind of see that as the probiotic on steroids in a way, because you're moving a whole microbiome from a donor, be it a human to a human or a dog to a dog. So you've got a larger number of bacteria, but also I guess what we have to reflect is that there's a lot of bugs in there that we can't even culture, so we don't actually know what we're doing. And the challenge with fecal matter transplants is that because the microbiome is going to vary from donor to donor, you don't know which is going to be optimal and best to go in a specific patient, if it's going to be of benefit. And I guess that's where, as you know, some humans who donate regularly and seem to have a high success rate get given the high level title of golden colon. So, but whether we'll ever get to a point where we have dogs that donate regularly and they have golden colons, I guess that depends. Only time will tell.
Yeah.
So, I suppose what we probably should just talk a little bit is about indications, really. So you mentioned chronic enteropathies, in acute situations. Are there any other situations, or?
Well, there have been some studies that are a bit less certain regarding their conclusion, but it could have an impact on chronic kidney disease, potentially.
Oh, really?
It could have an impact. Well, it seems to improve. There was a study done with a human probiotic containing multiple strains, actually, which seems to decrease the progression of CKD in dogs compared to placebo.
Oh, really?
It's just a pilot study, so we are far from being certain about that, and we sadly don't know how it works really, but there is a potential for that, and we know it can also help for patients with atopic dermatitis.
Okay.
So there may be a more broader spectrum of options. Actually, we don't really know. I'm thinking, for example, should we manipulate the microbiota for patients with hepatic encephalopathy? Because it could be certainly an area where the influence of the bacteria would be very important.
Affect metabolism of the protein.
So many. At the moment, the main information we have is on gastrointestinal disease and diarrhea, etc. But there are people that are exploring other options, and we'll see more and more of these. So.
Okay, because I guess in fecal matter transplant, I mean, there's a lot of area of interest in humans, and I mean, the main area that it's used is with C. difficile diarrhea in hospitalised patients with chronic antibiotic usage. And in fact, I'm pretty sure that the NICE guidelines now recommend fecal matter transplant over antibiotic treatment for that, because I mean, I think the success rate with vancomycin is now about 30 to 40% in some studies, whereas with 1 or 2 fecal matter transplants they can get that success rate up to 80-90%. Now, I guess we don't have that as a comparison in dogs, but certainly you do see in humans they're looking at it in chronic enteropathies, and I know that certainly in the States there's a number of studies looking at fecal matter transplants in chronic enteropathies, because I guess that all interrelates to the pathogenesis that we speculate about, breakdown of immunotolerance. The more you read about it in the human side, I mean, it's quite staggering really, in that the selection criteria for a potential donor, they have to have not travelled abroad, because they may have infectious diseases, but also right down to the body condition score, because there are some case reports of people receiving a fecal matter transplant and developing obesity, and I guess that reflects some of what we talked about at the beginning, the kind of effects on the whole metabolism really, which is quite staggering. So, I mean, as far as I know at the moment in dogs, there are some studies looking at, I know there's a recent one presented at ECOAM looking at HGE, and that didn't show an impact, but most of the studies I think so far have been on chronic enteropathies, and certainly I've done it in a few cases that of chronic enteropathies that have failed typical drug therapy, and not all of them have benefited, but some have. And I guess one area for me, understandably because of my antibiotic obsession and responsible use, is those patients that are on chronic antibiotics for antibiotic enteropathy. Could we be in a situation where these patients are not having chronic antibiotics but having a fecal matter transplant every 4, 6 or 8 months.
It's certainly an option. I think that more and more I've been discussing with vets where they were asking for advice about should we actually continue using antibiotics. We do know that antibiotics are not necessarily all good. And it seems to be logical. You all have been taking some antibiotic at some point in your life, and you know that can make you feel quite unwell.
Absolutely.
Well, it's proven that it can affect the microbiota very logically, because it will affect the good as well as the bacteria at the same time.
Doing a bit of, what's that advert? I can't remember what the advert is. Was it? There's one of the little pots that needs to go good and bad bacteria. I've diverted. I've confused you now. But I'm just thinking of. I can't remember. I used to take it for a while as well.
Sorry, they don't advert that in France.
Oh, of course. I suppose what we probably should do is just outline how it's done, and I think this is where your preference has a bigger advantage than mine. So I guess probiotics, how do you administer it to the patient?
So you take the pill from the the box and you give it to the patient. And that's all.
And that's it. And there we go. So I didn't even get a chance to do my pint. So I need to have a swig before I do my bit.
No, there are different type of formulation. I think the main issue with probiotics for the technical aspect is choosing the right one. And clearly at the moment we don't know what is the right one for dogs, and we will probably have to try and find one that is tailored to the patient. So each patient will need to have his own probiotic in theory. And as I mentioned, the one that we have available that are for dogs and cats only contain one type of bacteria. But there are some human options where you have multiple bacteria, and as I say, you can play around with prebiotics, number of bacteria, etc. At the moment, as far as I can tell, there is nothing that can compare any of them. So they can all be as good as far as we know. But we probably would need more information. So the main thing that I would say in the technical way is actually the decision of the vet to choose one or the other drug, which is not backed up by any kind of comparative study.
And is there any value in, if you try one prep, I presume then there's value in potentially alternating to a different preparation if you don't get a therapeutic response? I mean, I don't know.
Yes, certainly. A bit like when you try hypoallergenic diet, you certainly have some dogs that will respond to one and not to the other.
Not to the other. Okay.
One thing that I wanted to talk about as well, sorry about that, actually it's longer than I thought.
No, it's cool. No, I'm building up to my bit. So
we do have to be careful in patients with dietary hypersensitivities. Some of these probiotics will contain products that can actually adversely affect the gut. So it could be lactose, for example, especially for human products, or chicken flavor, etc. So there is a potential for this probiotic to actually start some immune response. So it's possible. It's not proven, of course, but it is a possibility. So we need to be aware of that. That's the whole thing.
Oh, no. There's disclosure. So I guess fecal matter transplant, a little bit more involved. So first of all, you've got to select your donor. And in contrast, in the human selection criteria is vast. They do a lot of testing, but at the moment we tend to focus on a donor that's got a good history of, how can I put it? Good GI history, so a sturdy stomach, and then we do routine fecal analysis, make sure there's no obvious parasites or anything like that. And then preparation of the patient who's going to receive the transplant, get the surgeons excited, think I'm going to do a transplant, withdraw all antibiotics for a few days beforehand. And then I suppose that if you look at the human literature, there's no actual consensus about which route you use and how frequent. So you can look at different human studies, and some will give it only per os, by a tube, a tube down the nose, or now in a capsule. Some will do by enemas, some will do daily dosing, some will do every other day daily dosing. So at the moment, I have in my patients where I've felt it was an appropriate thing to try, I've tended to do enemas under sedation. So do an enema of the patient, and then instill the liquidized stool into the patient's colon, and then leave them in situ for about 20 minutes and rotate them around. And I used to blend. I used to have my blender that, much to the horror of the nurses and the neurologists who just couldn't believe what I was doing, we used to blend it to get it more liquefied, but actually some of the later advice is that if you blend, you introduce air and you potentially kill some of those bugs. So now it's a matter of a deep breath and grinding it up into a solution. With most patients, I've given it per enema. There's been some dogs that have been willing to eat some of it in food afterwards. And at the moment,
beauty of working with dogs.
Beauty, well, in fact, there's probably lots of dogs doing this themselves out on fields. But but I haven't got enough personal experience to say whether one's better than the other. Obviously, Paros would be a lot easier. And if you are going to give any Paros, then you want to put them on antacids for a few days. In theory, it might improve the transit of bugs into the gut. So yeah, my technique's a little bit more involved. And I guess what we should just, I suppose, to conclude, just talk about, we've talked about potential indications, how you do it, potential benefits, but I suppose we just should talk about whether there's any drawbacks. Because any treatment intervention, there's a potential complication. You've already mentioned that some of the probiotics have potential food additives that can upset a sensitive bowel. Is there any other that you're aware of? Or?
Well, again, we are manipulating the microbiota, and it's something that is very, very complex. If we are talking about probiotics, we only give few type of bacteria. We don't know if they are actually good for that patient or not. And I think the one risk that we have is that we are replacing the normal microbiota into something that would be potentially less complex. And we don't know, a bit like when we have been selectioning breeds, etc., we have been unfortunately creating some secondary issues by selectioning these breeds. If we can actually do the same with the bacteria, we can selection the one that we assume are good but may eventually be found to be detrimental for the patient on the long run, and we don't know that yet, unfortunately, both in dogs and humans actually. So the probiotics option, because it's not complex, because it's something that is one or just like a selection of bacteria, can introduce this bias of having something not right for that patient. That's the one thing that I will certainly mention as the most important thing.
I suppose with the fecal matter transplant, it is more crude and less refined. So there may be viruses in that stool that we can't, if you do PCR work on a stool, you'll find hundreds of viruses that might not even be pathogenic. We don't know whether one type of microbiome will suit a particular immune system. And I suppose they're expanding lots of area of interest in humans, again using the obesity as an example, where there's obviously some link with metabolism that's had an effect on body condition score with people that have had some of these transplants, and whether we'll see that effect as we expand our understanding in dogs. This would be interesting to know.
The other thing that I've seen is change of mood as well. It can actually affect the moods. Some of these bacteria can produce tryptophan or other products, for example, that will affect the way the brain is working, and your mood actually can change. We don't know, of course, necessarily the mood of dogs, but it could potentially have an effect there as well. We could have change of behavior or change of learning abilities in patients that receive some probiotics.
Cool. Awesome. Well, you've almost finished your pint. So I've clearly been doing too much talking. So
I will need to introduce this new yeast into my microbiota.
We'll manipulate more microbiome with some more drinking. So we hope that may be of interest to some of you guys who are watching, and over the coming months we'll do some more topics with some different clinicians, and so keep posted.
And if you have any question, just give us a call and we'll have a chat about probiotics or everything.
Absolutely. Bye bye.